In today's video, I'm going to talk you through step by step what a safe amount of pain is to be working into if you're trying to exercise with joint pain. And make sure you stay tuned until the very end because I'll tell you exactly what you should not do if you experience pain in your affected joint whilst you exercise. Starting right now. Now, in order to move forwards with exercise and joint pain, we need to understand one very important thing, and that is pain is very complicated. It's very subjective, and there are many different factors that can make it better or worse. Hundreds, in fact, ranging from the weather to how stressed we are, our mood, our thoughts, our feelings, our emotions, what we eat, whether we're overweight, whether we have slept well. The list honestly is endless. But because of that, it means that the pain we're getting is not purely necessarily linked to physical factors like the amount of cartilage change that there is in our joint or anything else physical for that matter. Which means it is safe and okay to work into tolerable levels of discomfort because we know it's not doing harm or damage to our joint. Now, when we are advising people to exercise, we tend to try and follow the following rule of thumb. So here is a nice visual of what I'm trying to explain. So this very simple traffic light system is the rule of thumb when we're talking about how much pain is the right amount of pain to be working into. Now, we are trying to find the balance, okay? So some physios call it the Goldilocks principle. We're aiming for not too hot, not too cold, just right, somewhere in the middle. We have to appreciate that when we're exercising to try and improve symptoms, we are trying to stimulate change in our body. And the only way that we can do that is if we stress our joint or we stress our system in some way. Generally, that is going to mean it's going to be uncomfortable to a degree. But we need to monitor how our symptoms respond afterwards. So, the rule of thumb is working into tolerable low levels, 3 to 4 out of 10 discomfort is fine and safe to do. If that increases your symptoms for the following 48 hours, but it's low level and it's manageable and your symptoms settle back down to baseline within 2 days, that is a safe and appropriate level of discomfort to be working into. If, however, you do some exercise, it's quite easy and you get no discomfort the next day and it doesn't feel like you've done any exercise at all, then don't expect anything to happen. Nothing's going to change. Your exercise is way too easy and you need to complete it in a way that is more challenging. Similarly, if we go to the other end of the spectrum and you do some exercise and the pain is very sore and it lingers around for 3 to 4 days, but it's not manageable, then certainly we have done too much too soon. What we haven't done is do any harm or damage to the joint. It's just a sign that we've overloaded that area of tissue a bit too much and a bit too quickly. Now, in the same way that if you were a gym bunny and you do lots of exercise and then you have a period of time off, the first time you go back, you are sorer for longer and it can last a few days. The point I'm trying to make here is this flare up or this period where you're sorer for longer is more likely to happen if you haven't done much exercise in the past. So err on the side of caution when you try something new. Even if things feel quite good at the time, take it easy, maybe just do body weight exercise without any load initially, just to give yourself and your symptoms time to respond after. It is a much better situation to be in if you take that approach, things feel great after, and then you can progress, rather than doing too much too soon, having a massive spike in your symptoms and then it putting you off doing the exercise at all. Once you have found a baseline that you can achieve, then the key thing is make sure it's consistent, make sure it's consistently challenging, and then make sure it's progressed over time. They say practice makes perfect. It's the same with exercise. Once you've been doing it for a few weeks, you'll find it gets easier. You'll find that if you did have a little bit of soreness the next day, that will probably stop happening as well. It's at this stage that you need to push yourself a little bit harder because we want more adaptation, we want more change to those tissues and your joint. Now, at the beginning of the video, I did say if you stay tuned until the very end, I would tell you what not to do if you have pain with exercise, and that is stop. Now, I see it in a lot of patients. They come and see me, exercise has been painful, they're worried about doing more harm or damage to their joints, so they just avoid it completely. The bottom line is taking this approach is a slippery slope to gradually doing less and less and less. Your joint is likely to get more sensitive, the muscles are likely to get more deconditioned, and the chances are long term your pain will go up rather than down. So what we want to try and do if exercise is uncomfortable is let our symptoms settle back down and then change some sort of variable to make it easier next time you do it. There are lots of things that you can do to play around with to make things easier. Think about changing your repetitions, your sets, the amount of range of movement that you're completing the exercise through. You can change the load. You can change the duration that you're completing the exercise for. You could have more rest days. So rather than completing the exercise 4 times a week, you could try 2 times a week to begin with. The point is there are many variables that we can change to make things easier. And what we want to do is be dynamic, be flexible, adapt things and regress things rather than stopping things completely, because this is only going to lead to one thing, and that is increasing your joint pain rather than decreasing it, which is the end goal. So guys, I really hope you found that helpful. If you did, drop me a comment below the video and let me know whether exercise is helping you with your joint pain. Whilst you're down there, there is a completely free osteoarthritis guidebook I've put together for you that's all about trying to manage your symptoms without injections and surgery, which is what we all want really. And if you have enjoyed today's video, like it, subscribe, tap the notification bell. It means you'll get notified every time I bring out new osteoarthritis related help, which I do every single week. And why not check out this video on glucosamine and chondroitin for joint pain, and this video here to see what effect menopause has on osteoarthritis. Whilst you're doing all that, I'll see you in the next one.